Hi, this is QD Clinic. QD Clinic is brought to you by Room Now Live. I'm Jack Cush with Room Now. Today's case is it's remission time, or is it? So I got two cases I recently saw that have sort of the same conundrum. One, a patient with Still's disease who I've weaned off of Actemra, and two, a patient with lupus who I'm weaning off of azathioprine. The question is, are they really in remission and can I push forward? So the 68-year-old Still's disease patient, yes, that's right, 68 years old. You don't really have Still's disease over the age of 60. Well, she is one. She's got a great history of it. She's had high spiking daily fevers with chills, with even actually with weight loss, 30 pounds of weight loss, white counts of 25,000, ferritin levels of 17,000, hepatosplenomegaly, lymphadenopathy, great response to anakinra, couldn't take it, did better on Actemra, was on Actemra for almost a year and a half. The only thing about her diagnosis is that she had this fixed rash that would change sort of like by weeks, meaning that Still's rashes are supposed to be that evanescent salmon pink rash that come and go day to day, may come out with fevers and whatnot. She didn't have that. She had a different kind of rash. Um, Biopsy, non-specific inflammation. That's the only thing that she had. Again, great response to steroids, to Kineret, to Actemra. Before I got her, someone had given her Remicade, no response, and that's the story with Still's disease. And now she's done great. She's been in remission for, I don't know, almost a year and a half, off of prednisone, and I finally stopped her tocilizumab that she was getting IV. My rule is show me 1 year of disease inactivity with normal labs, and then we can stop therapy. Because Still's disease, I don't know how long the systemic disease is going to last. It's either going to be 8 months or 8 years. Anyway, we went off that, and all is good. She's been off the Actemra for 4 or 5 months, except now she's having a urticarial rash, intermittent, itchy, very itchy, clear-cut urticaria. And when you look at her labs, all her labs, white count, LFTs, everything's normal, exam is normal, but wait, her ferritin is high at 450. So do I rush back in with therapy? Do I treat the lab? Do I think that her urticaria is due to her Still's disease, which is entirely possible, by the way? I'm not going to do anything. I'm going to watch. I'm not going to treat a lab. I'm only going to restart therapy when she starts having high fevers and the rest of the syndrome. So the bottom line is she is still in remission. The urticaria is being evaluated and going to be treated symptomatically. We're going to follow her ferritin, her white count, her sed-rate CRP, and her LFTs, and we'll see what happens. The lupus patient is younger. He's like, it's a man. He's in his 40s. Clear-cut lupus with rash, arthritis, pleuritis, pericarditis in the past, hematologic stuff, has been on Imuran for a number of years in low-dose prednisone, and now he's down to 100 of Imuran, and I'm trying to wean his prednisone. His labs have been stone cold normal. Negative double-stranded DNA, normal C3, C4, normal white count. The only thing is, as I've weaned him down on prednisone, he's down to 2.5 of prednisone. He says now he has fatigue. Sounds like steroid withdrawal to me, but he does have a new lymphopenia. His lymphocyte count has dropped down to 1,100 when it was previously more than 1,500. And again, labs are all normal. And what am I going to do? It's the same story here. I'm not going to treat a lab. The symptoms are not enough to make me worry. I may have another explanation. In his case, just steroid withdrawal, and you just have to go slow. And we talked about sawtooth steroid withdrawal or weaning before. And I just going to observe him. The bottom line behind this QD clinic is worry about the patient when you see abnormal labs. It's not a knee-jerk reaction where you jump back on with a lot of other therapies. It's sometimes best just to ride it out and see how they do. Make sure you come to Room Now Live. One cool thing we're going to be doing at Room Now Live, it's going to be in great downtown Fort Worth. So if you get there on Friday, you can walk around. It's going to be a beautiful day. It usually is weather-wise. And then on Saturday night after our program, we're going to have a reception on the roof, outdoors. It's going to be fun. Great weather, good people. We'll see you there.